Hi, I'm Kathleen Hayes, and I'm here with my colleague, Natalie Meyers, and we're here to talk about securing the chain of custody and integrity of data in a global North-South partnership to monitor the quality of essential medicines. The World Health Organization estimates that 1 in 10 drugs found in low and middle income countries is substandard or falsified. Substandard drugs are genuine pharmaceuticals that fail to meet their quality standards, whereas falsified drugs are fake medicines that are passed off as the genuine product. The consequences of substandard and falsified drugs can be fatal. In 2012, poorly formulated heart medicines killed over 200 people in Pakistan. Substandard and falsified medical products are difficult to detect because they are designed to appear identical to the real thing, and in many cases, they don't cause an obvious adverse reaction, but they will often fail to properly treat the disease, which can lead to serious health consequences, including death. One reason substandard and falsified drugs are so prevalent is because of a lack of widespread quality control testing. Many low and middle income countries don't have the instrumentation or the infrastructure necessary for routine post-market surveillance testing, which is why this project started. In the United States, most colleges have the instrumentation necessary for pharmaceutical testing, including here at Notre Dame. The Distributed Pharmaceutical Analysis Lab, or DPAL, was created in order to leverage the testing capacity of colleges in the United States to analyze pharmaceuticals more efficiently. In this arrangement, drug dosage forms are collected in-country by covert shoppers in Ethiopia, Malawi, Kenya, and more places. From there, they're inventoried and sent to the University of Notre Dame. At this point, here at Notre Dame, we receive over 1,000 samples a year, which is far too many samples to be analyzed in our lab alone. So we created a network of colleges throughout the United States and abroad to assist with analysis. So once the samples are received at Notre Dame, they're inventoried and sent out to DPAL schools for analysis. There, the samples are tested and results are reported back to Notre Dame, and then to the relevant in-country agencies. As you can imagine, there's a ton of data generated through this process and quite a few pain points as well. In terms of data, throughout the workflow of sample testing, since it's a distributed laboratory, we have a lot of metadata and testing data to keep track of. On the left, you can see all the metadata generated in country. Then once the samples arrive at Notre Dame, we're adding to the metadata for our own testing results and for each distribution to one of our DPAL partner schools. In terms of the pain points in administering DPAL, right now, this data and its metadata are stored in multiple different forms on multiple different platforms, including Dropbox, Open Science Framework, email, and on external hard drives. The lack of centralized data management makes it difficult to operate DPAL efficiently. Additionally, our in-country stakeholders are not able to monitor the progress of samples through the workflow. They don't have convenient access to sample location or testing results. So now I'm going to turn it over to my colleague, Natalie Meyers, who will talk about our prototype solution for managing DPAL.
Thanks, Kathleen. We are using blockchain to manage key DPAL data. Why blockchain? We need a documented chain of custody for our samples. In our case, chain of custody means knowing who has what sample, when, and where. It's a chronological documentation of all parties that come into contact with a sample. We need to record these data together with time and date stamps to create a verifiable and permanent chain of custody for DPAL samples and our analytical test results that allows stakeholders to drill down to the details of exactly how analytical results were obtained for any given sample. The challenges to address and anticipated benefits of this project include creating a chain of custody for samples and their metadata that aligns with the distributed field testing process, detecting patterns of quality problems within and across different brands of products, and development of enhanced statistical sampling techniques and best practices for routing our work. Then, stakeholders can see where samples are in the workflow and see test results in close to real time. Our regulators and purchasers can deal with problem brands proactively, and we get increased throughput, cost savings for regulators, faster discovery of problem products, and fewer patients impacted. Through distributed ledger technology, or DLT, we can record also a history of all transactions, tests, and analysis associated with a sample, making blockchain a great fit for storing data shared between DPAL network participants. Our project uses DLT to secure the provenance of key information in our distributed ledger, and we link that to an easy-to-use dashboard. Stakeholders gain real-time access to work in progress and can verify the integrity of DPAL analysis data at every stage of the process, from sample collection to reported results. This state transition diagram depicts the possible states of a sample and its subsamples and the complete set of potential state-to-state transitions that the solution is expected to support. Our dashboard's administrative console allows us to assign work, monitor current state, and balance our load. A lab technician at any DPAL site can use the dashboard's testing and analysis graphical user interface to match their sample to the tests they're running. Test results maintain their connection to tested samples, and that relationship can be verified at every testing step. DPAL samples chain of custody includes more easily trackable and manageable shipping, receiving, and storage information. The blockchain-informed dashboard is a display of an end-to-end history of our actions, actors, test results, and sample locations. This solution supports an end-to-end history for audits and proof of provenance. This readies DPAL for how the FDA and other regulatory bodies are tightening their scrutiny of traceability and chain of custody. The dashboard also lets us take a bird's eye view of our distributed network of sample testing, understanding at a glance our work queues, the aging of samples, comparisons with historical norms, our productivity, and performance trends. Now I'm going to turn it back over to Kathleen, who will tell you about the supporters of this project.
This work wouldn't be possible without our DPAL participants, including Ayanu Ashraf at Addis Ababa University and Tim Johan at Roanoke College, as well as our technical support, including Dave Kachalko and his team at Artifacts, and our funding sources through the NSF, Pfizer, the University of Notre Dame, and the Ethiopian Ministry of Innovation and Technology. Thank you.